All right. It's about 1:03 right now, and I'd like to thank everybody for joining today's PCPCC webinar. The title of today's webinar is Patient Portals and Primary Care, What Use of a Portal Could Mean for Your Patients. During this webinar, you're going to hear from Dr. Mary Reed about the results of her latest study on how access to a patient portal affects utilization for patients with chronic diseases, followed by a discussion between Dr. Reed and Dr. Lisa Letourneau, who is clinical advisor to the PCPCC, and Rosalin Cox, a patient advisor. I'll tell you a little bit more about them in just a minute or two. This webinar was funded in part through a Patient-Centered Outcomes Research Institute Eugene Washington Picori Engagement Award, so we'd like to recognize them for that. I'm Rob Driven from Merck, and I serve as one of the two executive committee liaisons to the PCPCC Board of Directors. And in that role, I team up with Julie Schills from Mathematica, and together we interface between the PCPCC board and the executive committee membership. For those of you who are not members of PCPCC, I'd like to take this opportunity to encourage you to consider doing so and becoming members. Feel free to reach out to Jennifer Renton, who's the membership coordinator, at the email address on the screen. Hopefully everybody can see that. And if you're interested in joining the team-based primary care movement at PCPCC, please be sure to contact Jennifer. And this webinar today is just one of many examples how the PCPCC is contributing directly to the primary care movement. PCPCC, just a little bit of background for those on the line today, brings together more than 60 organizations to its executive committee membership. And I would argue and say that it really brings together thousands of organizations, but there are 60 who have taken that next step of becoming executive members, who are committed to an empowered, team-based primary care foundation of a high-value delivery system. As an executive member, you would be an active participant at the table that is already set with stakeholders from like-minded organizations, associations, initiatives, collaborating to determine the strategic direction of the PCPCC, so you'd have a direct say in that. You'd be able to join the collective voice of respected thought leaders working to achieve the shared principles of primary care. And you'd also be able to help the PCPCC directly and effectively respond to the healthcare environment, forging a path forward to elevate primary care so it can deliver on its promise to patients. All important reasons to consider joining the PCPCC executive membership. And finally, before we get into the subject of today's webinar, I want to make sure everybody knows the annual conference for PCPCC is scheduled to be held in Washington, D.C. on November 4th and 5th, so it's coming up real soon. Registration is now open at pcpccevents.com, and participants of today's webinar can receive a $100 discount by using the code webinar2019. And on the next webinars, we're going to be holding on October 25th, so that also is fast approaching. The title of that is Goal-Oriented Patient Care, Caring for Patients with Alzheimer's and Dementia. So be sure to visit the PCPCC website for more details there, and tune into the webinar, please, on October 25th. So now I'm going to introduce our panelists and welcome them to the discussion today. As mentioned, we have Mary Reed, who is a research scientist at the Kaiser Permanente Northern California Division of Research. Her research interests include health information technology and healthcare delivery organizations, and their effects on clinical care, quality, and costs. Also, patient knowledge, attitudes, and decision-making with respect to health insurance. Mary received her Doctor of Public Health at the School of Public Health at the University of California, Berkeley, and completed a postdoctoral fellowship at the Institute of Health Policy Studies at the University of California, San Francisco. We're also joined by Lisa Letourneau. Dr. Letourneau is an experienced physician and public health advocate who brings extensive experience leading large-scale improvement initiatives and will serve as a contracted consultant for the project, assisting with clinical direction, clinical engagement, and advancement of PFE, and also choosing wisely tools in clinical practices. In her former role, leading Maine Quality Counts, a regional health improvement collaborative, Lisa led several multi-stakeholder improvement efforts, including the multi-payer Maine Patient-Centered Medical Home Pilot, the Maine Aligning Forces for Quality initiative, and also the Northern New England Practice Transformation Network. And finally, last but certainly not least, we have Rosalin Cox on the line. Rosalin works as a school security guard and acted as a patient advisor during the planning and implementation of the research study led by Dr. Reed that you're going to hear about today. Patient voices and insights are vital to the PCORI-funded work. So following the presentation by Dr. Mary Reed, we're going to have a structured dialogue, and then we'll open it up to questions from attendees on this webinar. So Dr. Reed is first, and then we'll hear from Lisa, and then Rosalin right after that. So I'm going to turn it over now to Dr. Mary Reed. Over to you, Mary.
Great. Hi. Thank you. Thanks so much for the invitation to share our findings with you today. We were one of, I think, the first year of PCORI fundees, the Patient-Centered Outcomes Research Institute. And one of the ways that they approach research, I'm a researcher, so that part I know, but one of the ways they approach research a little bit differently was to really, in a way that we really believe in, to engage the stakeholders rather than using a very academic model of doing research. And so we had the opportunity to pull together a panel of patients who really partnered with us in designing, especially the survey portions of the study, and also to get some clinical and delivery system stakeholders to work alongside with us on this as well. So I really appreciated that process, and I'm glad that, grateful that Rosalin could make it onto the call today. So we basically set out, I guess I should give you a little context about the clinical setting that we were embedded. So I'm at Kaiser and Permanente in Northern California. We specifically have 23 medical center hospitals with outpatient services. I think it's well over 1,000 primary care physicians. We're an integrated delivery system in that inpatient, outpatient, primary care, specialty labs, pharmacy, imaging, everything is kind of well integrated within the system. So that sort of offered a really, I think, unique groundwork for thinking about patient portals and how they might affect chronic conditions care. Let's see. Oh, yes. I think I just advanced. We were struggling with that before. So here's a screenshot of the portal as it looked, I don't know, yesterday when I pulled it down. But essentially, there's been a patient portal available to patients in our system since, I think, about 2005. And so the study offered us a unique opportunity to think about how putting technology with patient information and an ability to communicate with physicians and interact with their healthcare in the hands of the patient might change the way that healthcare is delivered and the way that health outcomes are experienced. We started here looking at the patient portal, and we've continued, our team has continued to look at other things, other types of telemedicine, like video visits in the sort of current studies that we're working on. But sort of our approach was to think about how a patient portal might affect the way patients interacted with their healthcare. And so you can see on the screenshot sort of the various categories of functions that go across the top. Patients can look up portions of their health records, certainly lab results and history and visit summaries. They can exchange in that message center, exchange messages with their providers, so physicians they've seen before they can send email-like messages to. I think the providers are committed to responding to those within 2 business days, so they can sort of foster a conversation between patients and providers outside of visits. Patients can book appointments. and in more recent times also book not only in-person appointments, but also telephone appointments and video visit appointments, video telemedicine with the exact same provider, so with their own affiliated primary care provider. Pharmacy should be relatively complete for the patient so that they can see their meds and refill them. They can look at benefit information, and they can also interact with a variety of sort of health information tools and wellness modules to manage their own health. And so those are pretty much all in place, although there are tweaks over time. The basic framework was in place since about 2005, which gives us an opportunity to look at a relatively mature patient portal environment. So although the portal's been around a long time, I think that it's relevant to practices even today as they think about how to knit together both a full set of functionality for patients, but also thinking about how patients might interact with them. And then in 2011, the basic, all the infrastructure of the portal was basically available on mobile devices as well, both through a mobile optimized website and apps that they could pull down. So like I said before, we set out to think about, well, how are putting these tools in the hands of patients, on the desktop of patients, going to change the way that healthcare is delivered, particularly for patients with chronic conditions, not because we think that that's the only place it would make an impact, because these are not tools specifically designed only for chronic conditions management, but because we think patients with chronic conditions who have several balls in the air, both clinically and logistically in their healthcare experience, might be the ones who could make most noticeable use of a tool like a patient portal. So we basically want to know who uses the portal, who doesn't, and why or why not, and then how does using that portal affect the patient's healthcare experience and clinical outcomes, like I've been mentioning. We set about doing this with two sort of sub-studies, I guess, two different approaches. One is to talk to the patients themselves in a patient survey, and then the other was to do what we could to analyze the electronic health record data on visit rates. I think the two were designed to sort of complement each other. We kind of couldn't do one without the other and still paint a relatively complete picture. And the patient survey is where we really had a rich experience collaborating with the patient advisor. So I hadn't done this before. While I believe in the model, it's not something that, most academic research, NIH funded research encourages or even funds, but we took advantage of the opportunity that PCORI offered and even sort of mandated. We talk to patients and really understand what they think and make sure our study makes sense to them and answers the questions that are interesting to them. So we engaged a panel of 8 to 12 patients. I think it was twice a year for 3 years, and sat with them and said, these are the questions we've been, funded to look at, but what would make sense to you? What do you think is interesting? How would we design a survey around this? And I hadn't done that before, to really design a survey together with patient input. And I think they really helped us. I think a quick note on how that looked. I think that we, as researchers, came in with sort of relatively discrete things that we want to ask about. And as a pattern, at least, what I remember was that patients were fairly consistent at asking us to be more nuanced rather than just check the box here. Make sure you ask about this and that and leave an open-ended process for patients to reflect on their experience. So I think that really improved our survey and like I said, enriched our research process in ways that I hadn't experienced before. But in the end, what we got was 1,824 patient survey responses. We were really pleased with a 70% response rate. These are all patients health plan members over age 18 who have a chronic condition or two or more, included both people who use the portal and don't use the portal, and we had collected the surveys by mail, phone interview, or electronic survey. And then the larger automated data study included 165,000 patients with diabetes, including those with multiple conditions, and looked particularly at rates of in-person healthcare use, like I mentioned before. So what I'm going to do now is just kind of shift into rattling through as quickly as I can so we save time for discussion, rattling through the study findings as published. So you could definitely look up the papers yourself and get more information, but I'll just sort of take you through them so that we can discuss how they make sense in your setting. So the first paper I'll talk about is one that's looking at the patient survey results, like I mentioned, published in Medical Care. And we basically found that 3/4 of the patients were already portal users, and I think that reflects on the maturity of the portal experience here, maybe a little bit the technology leaning of the our underlying geographic area in Northern California. But in terms of who uses the portal and who doesn't, I think in the midst of our study, there have been other studies that published very similar findings. So I think that these are fairly sort of robust and confirmed in the evidence. But not surprisingly, older patients were less likely to use the portal. There were differences by race. Lower household income patients were less likely to use the portal. Those with lower education who didn't use the internet regularly or had fewer sort of devices, computers and mobile devices, were less likely to use a portal. I don't think any of these things will surprise anyone. Our thinking on portal use, I guess just to throw that out there, is certainly not that it ought to be used by every patient for every situation. We're definitely not going into it with that sort of gung-ho approach. Our interest was really to sort of describe how patients were using it, especially ones that might perceive health benefits or ways that it's improved their healthcare experience. So the goal is not to get this up to 100%. I will notice also that even, in patients over the age of 75, half of them were on the portal. Even among patients who are not even using the internet daily, nearly half of them were on the portal also. So it definitely sort of saturated to a decent degree the patient experience in our setting. We asked the patients who don't use the portal, well, what was important in your decision not to? Half of them said they basically prefer to get care in person or over the phone instead of through the portal. And I think that is persistent and sort of jives with what I was mentioning before. Our goal is certainly not to shift people over or away from in-person ways of interacting with providers, just to offer them a tool to complement that. And then the next largest reason was that patients who don't use the portal don't usually use the internet, and that bears out with the descriptive data I just showed you before too. There's some concerns about privacy or complications with sort of using the technology, but I would say that on the whole, those are fairly low. For the patients who do use the portal, we asked why. What do you get out of it? And we kind of asked these under three different buckets. The first one being sort of it's a convenient way to interact with the healthcare system. The second one being that there's information or data on there that's useful to the patient. And the third one, that it integrates with their other types of healthcare, their in-person healthcare experiences. So you can see up at the top in the convenience domain, those first four questions, 81% said it was more convenient than other ways of getting care, or again, 81% said it was helpful to get faster answers to their questions. Or the middle chunk, 89% said it gives me better access to my own health information. It helps me, 84% said it helps me organize my healthcare, including their lab tests, medications, and visits. I'll say I don't have time today to work through patient quotes and responses, but we have a broad set of those, both from our patient panel and from the patient survey responses themselves. And patients mentioned often being able to sort of revisit some of this health information prior to a visit in order to come prepared. It worked as sort of a patient record and essentially health record for them. And that sort of speaks to the integrating with other care. 81% said having a portal, being able to send emails to my provider improves my relationship with them. So again, we think of this as sort of a complement to in-person care. It improves the overall, 80% said it improves the overall quality of the healthcare I receive, and helps me, there it is, helps me prepare for in-person visits, 2/3 of patients told us. So thinking about these three different domains, sort of portals can improve convenience, give patients data to use, and complement their in-person care. I'll touch back on those three in the next slide. But before we go there, it's not all sort of puppies and rainbows. There are concerns and barriers to using a portal, even among portal users, which I think is important always to note. Here we have that same sort of sentiment that while patients are using the portal, they still prefer in-person care. And there's a third of them said they still preferred in-person care, and there's no reason to approach that in a sort of a replacement mindset. There were still some privacy concerns. To some degree, I'm not sure they're totally overcomeable, I guess, the way that technology works. And now we're going back to those three domains that I talked about earlier: convenience and information use and integration with in-person care. So in this case, we asked patients, and this is something very hard to get at in an automated analysis, but we asked patients directly, which was sort of one of the strengths of our study. Do you think using the portal has improved your overall health? Like, do you feel like you're healthier for having access to a patient portal? And a third of patients said yes. They think that using the portal has improved their overall health and could tell us nuanced stories about pathways, clinical pathways in their own life where they could sort of point to a health benefit. So if a third of patients say that portals improve your health, then we sort of plotted that health improvement according to these three domains: convenience, information use, and integration with their clinical care. And so we basically find that patients that report any of those domains were actually more likely to report it improved their health. The portal use was improving their health. So we interpret this as sort of likely pathways to health improvement. How do you improve your health? Probably by taking advantage of the convenience, by using your own information in the portal, and by bringing it into the doctor's office visit in order to sort of integrate it with your other portions of your healthcare. And then conversely, those who reported a concern were actually much less likely to report a health improvement. And so we think that some of those concerns are clearly acting as barriers and are probably room for improvement. Rattling these off quickly, I'm just going to shift gears a bit. So the other survey finding that we were able to publish in a JAMA Internal Medicine Research Letter was one that I think really came to us from the patient panel. They pointed out the unique aspects of a portal in helping family care partners interact with a patient's care. So this is when a patient might not log on to take care of their own information, but either a caregiver or just a family care partner, a person in the household who takes care of these things, might be able to go onto the portal and do things like schedule visits or interact with physicians or make appointments or look up lab results. And so we were able to publish separately a piece on this sort of family care partner role because it can be really, the technology makes it so that there's a ability to do it even across geographic distances. We heard about families that, might be even in different states and are able to sort of participate in a family member's care through the technology that the portal offered. Couple quick findings there. So about 28% of all portal users said they'd also used it on a family member's behalf, mostly for a spouse, but also for a child, of course, and then also for a parent. So there's a lot of intergenerational use. One kind of nuance, maybe this is fun because I'm a researcher, but it is that I think when we look at who officially logs into the portal using their proxy ID as a family member, it's probably about a half. And there's a lot of informal proxying where patients or family members might just sort of share their IDs interchangeably. And so sometimes, and we've heard this from our clinicians in our stakeholder panel, sometimes it's not totally clear to the physician, or they have to read between the lines to figure out when someone's sending say a message under the patient's account, whether it's the patient or maybe, the patient's wife or the patient's child. And so there's a little bit of confusion there when, depending on the way that family members might interchange their IDs. But this part was loud and clear that family members who are using the portal on behalf of someone else said that it's more convenient, that it helps them to organize their family members' health information, and that it's faster in some ways. So we felt like that was an exciting contribution to sort of the patient experience literature. And then I'm going to shift here to some of the outcomes on healthcare visits. So this is where we took just automated data only. So we think one of the questions that's sort of persistent out there is whether or not using a portal looks like it's going to offset the office visit rate. Are patients be able to use these tools so robustly that they basically can make it so they don't need to come in and see their doctor? And our answer was resoundingly no. In fact, and in this case, there have been a few papers on this already, and we really went after it with the best statistical methods we could come up with. So we feel like, this is observational data, but it's probably, to me at least, as good as we can kind of get here. Overall, we saw that office visits were higher when a patient was accessing the portal. And then when we broke it into, because we're particularly interested in complex chronic conditions, what here is 2 or more conditions, diabetes plus other chronic conditions, we found that consistently both the patients with just diabetes and those with complex conditions were seeing their doctor more when engaged through the portal. So we interpret that as sort of an engagement tool that patients, when they're engaged with their own data and tools, often are engaged in their healthcare, hopefully picking up, receiving healthcare that is meeting unmet needs. And when we look at emergency room visits, then we actually see the reverse pattern, that patients who are using the portal, that's the darker blue bar, have fewer emergency room visits than patients who don't. So we think of that sort of as a complement finding that office visits look like they're higher, but emergency room visits actually look like they're lower, and probably a little bit more lower in the patients with the complex chronic conditions, because potentially there's more room for improvement or reduction in emergency room visits. And then we take it one step farther and we look at preventable hospitalizations in the way that they can be categorized using a federal algorithm. And we again see a reassuring thing where the patients using the portal, that's the darker blue bar, look like they end up in the hospital for a preventable reason less often, particularly, again, these complex chronic condition patients, which we took to be good news. It was pretty exciting to be able to pick that up. But really, we still feel like it's a complement of patients showing up in clinic more often and getting what they need so they don't end up in the emergency room and don't end up needing a hospital stay, essentially. So the overall conclusions as we see them, and I could go into this forever, but I'll just quickly rattle them off so we can start discussing them, are that we feel like patient portals appear to be a patient-centered tool, that they have potential to improve health engagement, and they can actually improve health outcomes. The patients appear to not need some of these more serious health events in the end. And in terms of who uses the portal, it varies, probably in the ways we'd expect, by patient demographics, technology access, clinical need, but that patients report that it improves their health, and that maybe these convenience, information use, and data integration pathways are actually pathways to health improvement. But that overall, when patients with diabetes are using the portal, they look like they're getting greater engagement in outpatient visits. I didn't get to show you this one. There's another sub-finding where we looked at the timeliness of treatment, and it looked like improved of treatment intensification for patients with diabetes, and lower rates of these health events like ED visits and preventive hospitalizations, with greater improvements in patients with complex chronic conditions. I think I'll stop there, and then I'm looking forward to the discussion.
Great, Mary. Thank you very much. Really interesting, and really encouraged by the results you shared about the increase in visits on the primary care side and the decrease on the ER side. So interesting, very, very interesting and promising. So thank you for all that information. We're going to turn it over now to Dr. Lisa Letourneau. Lisa, over to you.
Great. Well, thanks so much. And thanks, Mary, for doing this work, number one, and for sharing your results with us on the webinar today. Just a huge kudos for this work to really engage patients. As recipients of a PCORI award right now, we're just thrilled to have the opportunity to work with you, share the results of for those maybe new to this work with PCPCC on the phone. PCPCC is a recipient of a PCORI grant right now to find ways and build our own organizational infrastructure to better share the results of important research like this. So this is one example of that. So thank you so much for doing the work, for sharing it, and for being so committed to engaging with patients. I was really impressed by your work starting out by surveying patients, getting a 70% response rate. That's unbelievable. I think we need your fairy dust, whatever you're doing there. That's amazing. So I'm really eager to hear from our patient representative as well. But just a minute before that, I guess I would ask if there was anything that surprised you from this work to start out, from the results, perhaps.
Yeah, I think the thing that was most surprising was the office visit increase. I think that there had been, people had various theories about this and had been bouncing it around for a while. There were people who were pretty convinced that there would be an offset in the visit rate, and others who thought there would be an increase. So I think that, at least for me, our findings sort of nail that there really is probably an increase as patients get more engaged. I think that was the most sort of surprising or notable, because I truly had no idea what we'd find. And then the health benefits were kind of icing on top of that. To really see a reduction in events was pretty exciting. Great.
And again, because the numbers are so high, clearly in terms of portal use and even engagement in the study, and you referenced this clearly, a link to the long-standing culture at Kaiser. How long, and I apologize if you said this, but over what period of time do you think this whole ability to work with patients in this way, using portal and internet access and communication like this, over what period of time, if practices are just starting out on this work, what should they expect?
Yeah, that's a good question. So in some sense, we studied a fairly mature setting where the portal had been available for over 10 years. I'd say, though, that portal use at Kaiser, and I think patients are sort of acclimated to that culture of being able to interact with the healthcare system through various technology tools. Although I'd say that the part of that sort of grew about the same time that internet access in our country was sort of expanding. So I wouldn't expect necessarily that it would take 10 years to get there if we started today. If someone implemented a portal today, I would hope that learning curve would be compressed to the degree that, not everyone, but many of us are used to using the internet and our smartphones to interact with all kinds of things that we didn't do 10 years ago.
Sure. Yeah, great. Okay, should we also bring in Rosalin perhaps, and then we'll keep the discussion going?
Yeah, Lisa.
Well, hello, great. Mary. Hello, everyone. Hi, Mary. It was so wonderful to work with you on this project.
Thanks for being here.
It was. Thank you for having me. Also, it was wonderful to work with her and the rest of her group that she worked with in the findings and asking the questions that we need to know. And me as a patient, using the portal, it was wonderful to give my input to let Mary know exactly me as a patient, on my end as a patient with chronic asthma, it is very useful. The question I did have for you, Mary, was I was looking at the slide regarding the diabetes users. Now, how did you get the outcome of that from the survey that you sent out to the diabetes users? Was that a separate survey that you sent out, or was that just when they all came together when you sent out the survey to everyone, to all the patients? Was that in some type of separate? That's what I needed to know.
Yeah, it was the other chunk of the study. So the diabetes-related counts of visits are not related to the survey at all. That's why we needed the survey to kind of fill in the picture, basically. So as a researcher, we were able to count things. Counting things doesn't tell the whole story. So essentially, we were able to count the number of visits people had, but that's it. It just sits alone unless we were able to knit it together with some of the things that patients told us in the survey about how they were using the portal or why. So they're kind of two different chunks of the study separately.
Okay, and then part of the study, I saw that that it was more that when you did the study and sent out the surveys, I saw that there were a lot of the nationalities that did do the survey, because we were talking about that in our group that we had, about how many was going to respond for what different nationalities. And it was great to see that everyone in all different nationalities did respond, because we were kind of wondering about that too, because a lot of people, were afraid to do the survey. We were kind of wondering, some people didn't want to do the survey, but I'm glad that I saw that all the nationalities, did participate. And I wanted to know, so how did you send out the surveys to the patient? How did that come about?
We used a protocol that we had used in prior surveys, and I know that we talked it over with you and the other panelists. I don't remember what things we learned. Every survey study has its own life of its own, I always say. I guess it depends on the patient. We have to fit our survey into their lives, and our survey is not at all important to them, I always think. So we basically asked patients, we want to make it as convenient as possible, and we asked patients to self-choose. We gave them all their options. We mailed it to them. We called them a few times over the phone, and we also sent them an email link if they had an email contact information already available, so patients could choose which one they want. They were all the same questions. It was just our goal was to make it as convenient as possible for them. I think we also offered a coffee gift card. I don't remember if it was $10 or $20.
Remember we did say that maybe an incentive for, you know, some way for them to fill out the survey. And for that, the 70% rate, that's very good. That is really, really good. And I appreciate you a lot, Mary. It was well working with you and the rest of your staff, you know, on this research, you know, and from what we had before to what we are now, it's a lot more patients now that's using the portal, you know. And I also put out the word, too, you know, about the portal, you know, and it's very easy, it's very convenient, you know, and like Lisa was saying, everybody's, you know, on their phones and everything, their smartphones. So, and I always let everyone know you can always use your smartphone or however to even talk to your doctor, get on the portal. You know, it's easy to, you know, to get on, to connect, passwords and usernames. You know, I've had people that today ask me, you know, how do you, when I go to Kaiser, how do I use the patient portal? So, you know, I kind of run it through it too, you know, and it was wonderful to work with you, Mary. Very, very wonderful to work with you and your staff on this. And I'm very proud of you, very.
Thank you.
You're an ambassador, Rosalin. This is great. So this is Lisa. I'm going to jump in again. So, you know, I think we saw some good results from the study in terms of particularly the second one that you referenced, Mary, in terms of engagement from patients during office visits. But thinking broadly, do you think that patient portals are a good tool for patient engagement? Generally, do you think there are limitations? So I'd love to hear from maybe Rosalin first and then Mary.
Well, for myself, I believe it's really, really good. I mean, I still go in for my regular visits and things of that nature, but when I was working with Mary and her staff on this study, you know, I was mentioning, you know, I can email my doctor at 2 o'clock in the morning, and by 6 o'clock, 7 o'clock, I have an email right back from him. So it's very convenient. It's very fast, you know. It saves a lot of time to call because sometimes you can never get through. So it was very easy, and I really like it. I really do. I really like it. You know, and like we were talking in our study, you know, a lot of people aren't, you know, computer suave. So sometimes it may be hard, and then sometimes some patients like to see their doctor, you know, like to go in instead of talking over or sending an email to them. But for me, it's very convenient. It is very convenient. And I do recommend all patients to, you know, to use it, you know, to see how they like it. You know, some people don't like to use computers, so, but I really did like it. I use my portal all the time. I was just using it just yesterday.
Great. And Mary, any thoughts about that in terms of contribution to patient engagement, what the limitations might be?
Right. I think, I mean, the study findings essentially confirm my intuition that I think it does sort of offer patients a point of engagement if it fits their needs and their own preferences. I think that information is powerful, and being able to put that in the patient's hand, even just to look at their own data, has potential engagement benefits. When I think about limitations, it's primarily probably the barriers that we saw. You know, like Rosalin said, it's not going to fit everyone's preference, and that's fine. I think our goal as a health system has always been to improve the user experience, and it's fairly, you know, no technology is perfect, but there are fewer barriers to using the technology than there used to be, and I think that would be, you know, one of the major limitations. Another thing that's just sort of as a jumping off point I can think about as a limitation is I think our system is constantly working through the clinical workflow for managing portal messages and traffic. So offering sort of a connection to your physician through an electronic patient portal sort of introduces a new type of work to the clinician's workday, and we're sort of always trying to work that through as well. And so we have separate studies looking at that. But that could be also a limitation. That are sort of things to be worked out.
Yeah, I would imagine there's a lot of work to be done there. And just on that for a minute, do you feel that you all have made good progress in there? Because I do certainly hear that as a frequent concern from clinicians about offering new tools like this. Great, another few hours at the computer, right? You want me to do another few hours, so yeah, understandable concern. Do you feel like you've made progress on that front?
Yeah, I think the clinicians, the medical group is always sort of adapting in the ways that they deal with it. Like I said, we have an ongoing study that's sort of looking at that I'm a collaborator on, and I think the the findings aren't firm yet, but the lesson is definitely that people deal with it in different ways. The physicians, is in the same way that we can collect patient preferences and experiences with the portal, I think you could collect, a wide range of physician preferences about, computer work, like you said, or when to do it and how to squeeze it in between their clinic visits, how to handle things like when physicians are out on vacation and things like that, how to have a pooled resource to sort of take care of those so you don't come back to a giant inbox. So I think it's an ongoing conversation here. We'll hope to publish a little bit on that too.
Yeah, it seems like a great.
I'm sorry, Lisa. This is Rosalin. I have a question, Mary. Now, I'm jumping back. Now, you mentioned on one of them, slide 21, that it had decreased the hospitalization by some of the patients using the portals. How is that so?
So that's what I meant earlier when, we can count these things, but it feels sort of, in a vacuum, that seems kind of like, really? But I think as we walk through it, we think about patients telling us it's actually helping them in the day-to-day.
Okay.
And we think about patients saying, we look at the pattern of visits, outpatient visits. They're visiting the doctor more often. We hope that means that they're getting care they need from the doctor's office visits, and eventually they don't end up sicker in a way that would put them in the emergency room or a hospitalization. So it's kind of, that's why we walk through it in that series of findings. And I think if anyone were to show me just the last slide of our talk at the beginning of the study, I'm not sure I would believe it either.
Okay. Oh, that's wonderful. All right. Thank you, Mary. Once again, it was wonderful to work with you and your staff on this study. And I want to read the book. So my question is, how do I get a chance to get a copy of the book?
We will send it to you.
Thank you so much, and I encourage everyone else to get one too as well. She's very good, and thank you so much, Mary, very much.
You're kind. We really appreciated having you on the team.
Thank you.
So
it was wonderful.
So great work, but always looking to move ahead. Any thoughts, Mary, on how the study could be improved upon? What future research? You talked a little bit about the provider side just a minute ago, but any other thoughts that it's triggered for you in terms of next steps?
Well, one thing that's fun about studying something like technology tools that are rapidly changing is there's always kind of something new to study. So along those lines, I'm sure that, there's always room for improvement in what we did, but there's also room to sort of broaden it or grow it to the latest things. So some of the tools that we've been looking at more recently include, like I mentioned, video visits between patient and physician, which are now schedulable by the patient on the portal. So as a patient goes on to schedule a visit with their doctor, which they do all the time, they actually choose equivocally between telephone, video, and in-person clinic visits. And basically with the same availability and with the same physician, not a third-party consumer telemedicine pool. And so we're pretty excited to look at how that impacts things. And then we also have sort of in the past year offered more e-visits, which are sort of structured patient questionnaires on the portal. So for certain things like UTI, patients can answer a set of questions and clinicians can look at the responses together with the patient's electronic health record and maybe directly treat. So those are two sort of relatively new things on our portal that weren't around when we did the study, but we have sort of the fun chance to look at the impacts of now.
Oh, fantastic. Huh. And then, if you're doing the great example of e-visits as, sort of purely technology. So on the one hand, very attractive, more efficient, probably very able to address issues appropriately in many cases. And others might look at that and go, gosh, is that creating a barrier? If patients aren't seeing their clinician, don't have an opportunity to talk to them. How would you respond to that?
Yeah, I'd say, that's always a question about in which places are we assuming technology can do something that don't fit the patient's preferences. And so at least the system goals here have never placed any of these technology options over in-person access. So essentially these are patients get to choose what they prefer. In the same way that I was saying to Rosalin earlier about our survey, I think that the goal has been to just improve access to the patient in various ways. And so I don't perceive certainly that there's any sort of effort to steer a patient towards a technology tool over an in-person visit. And that's one of the things that makes this easier to study here, is because all of these are these portal tools and these technologies are offered to patients with consistent in-person access. So we're not really thinking about, like when I referenced earlier, some of the third-party telemedicine tools are things where, you could get an answer now, or you could wait if you went through a traditional channel, potentially days or weeks until you get a in-person visit. In our setting, the availability is really fairly equivalent. So we don't perceive them as creating a barrier, just creating an option, and patients can choose. Yeah, but the lag on visit scheduling, either a virtual visit or an in-person visit, is essentially the same. Access is good.
Yeah. Great. Okay, and then maybe just or Rosalin, you want to jump in on that at all? Are you concerned that there's creating barriers at all?
Well, I don't think that there are really any barriers with the portal, or just, at all. It's just, we just would like to have more patients use the portal, and I think as time goes on that it will be available for more people to use it, but like Mary was saying too, a lot of patients is they're just used to just going in, and not doing, on the computer and things of that nature, but I think, if patients, did actually use the portal more, maybe the increase of less hospitalization and less illnesses, may be deterred if they, use it more than, going into the doctor or, walking in more. I think they should use it more than what they do. But I believe maybe that once again, I was going to say probably maybe if we could put the study out again, the survey, and see how many more we could probably get with the survey. Mary?
Yeah. I mean, I agree. It's a sort of a time-changing thing. It would be great to be able to
because I think the numbers of the percentage will go up. But I believe what we have now is really, really good compared to what there was not, that we didn't have at first, with the 76%. But I was thinking maybe we could probably put the survey out again, sometime in the future to see, how that would work. And I think our numbers percentage rate would go up, especially with our senior citizens.
Great. Yeah. So I'm going to turn it back to the audience here and see, we've got quite a few folks who have joined us. If others have questions, and I believe you can either chat your question or remind me, can folks speak it? Are there lines open?
Yeah, Lisa, thank you, Lisa, and everybody for their input here. Great discussion, and I do have access, Lisa, to the to our own portal here on the webinar for questions. So I'm gonna read a few of them, and realize that some of these questions might have been asked even 30 minutes ago as you were talking, Mary. So bear that in mind, and it might be a good reminder for some, even if you did address it in your content. So the first question is regarding patient input and getting specifically related to families and caregivers caring for medically fragile kids. So the question is, was there any talk to families or caregivers of those types, of those kids who would be considered, as this person put it, medically fragile?
Yeah, that's a great question. So as a researcher, I don't directly get to manage or create the portal technology itself. We had those as stakeholders in our study, and so I'm in touch with them. I get the sense that they get a fair amount of patient input. They do a lot of focus groups and things like that. in order to improve the portal functions themselves, I actually have no idea whether they've reached out directly to engage families and caregivers, although I would presume that they've had some feedback. But I don't happen to know that one.
Okay, thanks. Here's another one. It's regarding the results that you had shared, and this person is asking about whether if you explore the results and whether they depended on how often patients used the portal. So, for instance, a heavy user of the portal versus occasional users, or users that use the portal just a few times a month. Did you actually see an increase in the visits for patients using the portal by comparing before and after patients' use of the portal? So that's the gist of the question.
Yeah, it's a very astute question, and we struggle with this a lot with our study statisticians. You would assume if something helps that if you use it more, it would help more. The trick is how to study that statistically, and because portal use, patients don't just, use the portal every Tuesday. They use the portal when they have something to use it for, and those events that they have to use it for tend to have to do with, health concerns or problems that they're managing. And so we really struggle with how to do that well. And in the end, we're advised by our statisticians to just look at people at the point at which, and we were comparing them to themselves, whether they were using it or not using it, to not sort of get caught up in that convoluted confounding of patients essentially use the portal more when they're sicker.
Yep.
Hopefully that's clear.
Yeah, it is. Good question. Here's another question about recalcitrant physicians and other healthcare professionals. How are these individuals convinced to participate in a patient portal? I mean, in portal use overall?
Yeah, I think that's a good question too. I would say, and I'm not a physician, but my sense definitely in hearing about it is that physicians in our setting do vary and continue to vary probably in how much they promote portal use with their patients or how quickly they respond to secure messages and things like that. I think that there's probably, a variety of practice cultures, and some of those might fit the preferences of their patient panels even. I think being in a large system like this offers less choice to basically tune it all out. But I think there's still variation, because the portal exists and it's widely implemented, and there are expectations to manage it to some degree. But I do think the level of enthusiasm probably varies. I know that they also have physician champions who've volunteered to sort of be technology leads for their colleagues. And I think to some degree, maybe there might be sort of just peer championing that goes on at the between physicians. Yep,
got it. And building on that, another question came in more specific to your organization, I guess in this case Kaiser, about your point before, Mary, about promotion of the patient portal. How does your organization go about getting more patients engaged with using the portal?
Yeah, that's a good question. I'm actually not aware specifically recently. I think that there were some efforts early on, but I don't know exactly how they promote it primarily to new members, besides just educational materials might be around the clinic. I don't know if you've run into any, Rosalin, ways that they've promoted portal use or that your provider has individually. I think that maybe our use rates are reasonably saturated enough that maybe it's left to word of mouth or posters, but I don't know of any educational campaigns myself.
Yeah, I haven't seen any. I've always made sure word of mouth, and I do hear other clinicians, word of mouth. And they do have it, I'm in Northern California. So the Kaiser I attend, I do see where they do, have a board that says, use the portal, get to contact your doctor quicker, but it's not like billboarded, outside of Kaiser. Mm-hmm. Does that make sense?
Yeah, I agree.
All right, thanks, Rosalin and Mary. Mary, the Kaiser, there's a pretty significant % percentage of visits, I think, and correct me if I'm wrong, that are considered to be virtual visits at Kaiser. Is that what you have experienced over there? And if so, I'm wondering if there's any difference in portal use between a patient who uses virtual care versus a patient who typically goes into the office physically.
Yeah, well, so like I mentioned, I think that there are a variety of ways to virtually talk to a physician, for a patient and a physician to virtually talk to each other. I don't know if we've exactly split it apart as, you know, these are patients. Like I said, I think it's more mixed than you would think in terms of patients who might prefer a virtual visit today because they're stuck at work and they have this thing that they need to get fixed. But, you know, for a different concern, they might really prefer to walk into the clinic and sit and talk to their doctor face to face. So I don't know if we've sort of split that out in quite that way. But I do think it's likely, and I don't have data on this right in front of me, it's likely that patients who prefer one technology might be more open to trying another one, or might use a patchwork of different virtual tools to complement their in-person care. I think that's probably pretty likely.
Great, thank you for that. And on that note, we're going to close. I'd like to thank all of today's experts for your intriguing insights. Thanks to everybody also for participating in today's call, as well as the people who asked questions. You'll find some additional resources from our panelists on the slides that they had provided. The slides will be available for download on the PCPCC website. And remember to check the website for registration information regarding upcoming webinars like the one I mentioned on October 25th. And also don't forget about the annual conference that's coming up in Washington, D.C. on November 4th and 5th. Again, many thanks to our panelist experts for your insights today. And I hope everybody has a great rest of the day. Take care.
Terrific. Thank you all.